Okay, the next type is called nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus. Nephrogenic diabetes insipidus means that the amount of the hormone itself is normal. The hormone is secreted properly from the hypothalamus. But the problem is regarding the function of the hormone itself. That's called nephrogenic or peripheral diabetes insipidus. The hormone, once released from the hypothalamus, or the posterior pituitary, I mean, it will go to the kidney, okay, to function, but there is a resistance to its function. This resistance usually is due to chronic renal failure. Maybe the patient is already having a renal problem or chronic renal failure. So the arginine vasopressin is not working properly. And also there are two hereditary forms of nephrogenic diabetes insipidus. One of them is X-linked defect. And don't ask me what is X-linked defect now, because you are going to have the all types of genetic defects, autosomal dominant, autosomal recessive, X-linked, all of that in the genetic session, but just know the name for now, X-linked genetic defect. One of them is X-linked, related to the inheritance on the X chromosome, I mean, and this causes failure of the V2 receptors in the kidney to function correctly. So now the arginine vasopressin go to the kidney. This is the V2 receptors we mentioned. These V2 receptors are not doing their function properly because there is a genetic defect related to the X chromosome. We call that X-linked genetic defect. That's the first hereditary form of nephrogenic diabetes insipidus. The second one is related to the genes encoding aquaporin channels. The water channels, if that is the collecting tubule like that, there are channels here which transmit the water. We call them aquaporin channels. And these channels are encoded by certain genes, as any as any cell in the body or our body to be formed, it should be encoded by certain genes. If we have mutation in the genes encoding these channels, mutation in the genes encoding these channels, causing breakdown of these channels, so they cannot absorb water properly. Like if we have that's a gate, for example, that's a gate, and this gate transmit things in one direction only. If you break down this gate, so anyone can move in any direction, it will cause a chaos like that. That's a close example. Like this is a channel which permit water retention. If this channel has problem in its structure due to problem in the gene encoding this channel, this will cause the channel being unable to absorb water, and the water will be escaping through the urine, causing polyuria. And this type of defect is autosomal recessive defect. So the defect related to the receptor itself is X-linked genetic defect. The defect or the mutation related to the aquaporin channel is autosomal recessive defect. So we have three causes now of nephrogenic diabetes insipidus. A single cause is the patient is having chronic renal insufficiency or chronic renal failure. Or we have two hereditary forms. One related to the V2 receptors is an X-linked genetic defect, and one is related to the aquaporin channel, which is an autosomal recessive defect.